You're watching News 360 live from Adesanwe. You may send your comments to our social pages.
That's Facebook or twitter.com/news on TV3. And away from education, a research conducted by Inclusion Ghana, a non-governmental organization, has shown that many persons with intellectual disability and their parents are not aware of their health rights and how to advocate for them.
As a result, persons with intellectual disability face discrimination when accessing health care.
A person is characterized as having an intellectual disability when they have a significantly below average intellectual functioning, also known as intelligence quotient, below 70, and a deficiency in 2 or more adaptive areas such as learning, communication, social skills, self-direction, and self-care. In Ghana, it is estimated that between 2 and 3% of people have an intellectual disability. Inclusion Ghana, a network organization which advocates for persons with intellectual disabilities, has conducted a research in 6 districts in the country on barriers that persons with intellectual disabilities face when accessing healthcare. The research was supported by Star Ghana with funding from DFID, DANIDA, the European Union, and USAID. Findings of the research showed the health status of persons with intellectual disability is often poorer than that of the wider population, and more so for persons living in rural areas. Intellectually disabled persons, according to the research findings, face negative and discriminatory attitudes among healthcare staff, along with lack of ability to respond to different communication needs and behavioral challenges. Despite the passage of the Disability Law in 2006, which espouses the rights of persons with disabilities to free health care on the National Health Insurance Scheme, many persons with intellectual disability, their parents, the public, and the medical profession are not aware of this right.
When you go, it's like they mingle us with the regular children. So you join the queue and then you go, and it's like the person doesn't actually have time to listen to you and the child, because he has to use his gestures to tell me what is wrong with him. Then I will interpret, and it's like we are wasting time, so they don't get time for us as we need.
First, the front desk before entering the healthcare, that's where the problem starts. So at times it is even difficult to go beyond that. So the best thing is you withdraw, and then maybe you have to find a private doctor, and then you go scot-free.
Inclusion Ghana has held a workshop in Accra to strengthen the capacity of persons with intellectual disabilities and their parents.
Some of persons with intellectual disability, are killed. Some are chained in the rooms. If you come to health, because of the level of stigma and discrimination, some parents cannot even take their children to their hospitals. And what we also do know is that this population or persons with intellectual disability, have poorer health.
Most people do hide their children, okay, and it's making it very difficult for them to even access healthcare. One major problem is their inability to handle these persons who are intellectually disabled, especially with communication.
Inclusion Ghana hopes to collaborate with stakeholders in the health industry to advocate for the healthcare rights for intellectually disabled persons.